Before you can understand the pathologies of tissue, you must understand the normal structure and function of tissue. A PTA's understanding of cell injury, inflammation, and the stage of the tissue healing will serve as a solid foundation for their clinical decision making. We must be aware of where the patients are in their healing process in order to decide what they are able to do. This knowledge will directly influence your choice to pick one therapeutic exercise or activity over another one. We begin with the phases of healing. Inflammation is the first phase of healing. You see that word hemostasis? Ignore it for right now. We'll talk about it later. Inflammation must occur for healing to occur. Inflammation is an almost immediate reaction to cell injury. It can be triggered by tissue damage or the presence of bacteria. The inflammatory process is responsible for the removal of the injurious agent, the removal of the debris, and to initiate the healing process. Inflammation must happen for healing to occur. The goal of healing is to achieve complete restoration of function and total regeneration of the damaged tissue. This is often not possible, and the body will settle for tissue repair by using non-functional connective tissues like fibrous or scar tissue. We will discuss this more later. Note the overlap of time frames in these stages of healing. This is because there is a wide variety in how normal people heal. These time frames reflect the range of possibilities. Looking at this overlap, I can imagine you thinking to yourself, how will I answer this question on a test? And I will tell you that each one of these phases has very different presentations, and I wouldn't simply say what phase of healing is a patient in on day 6. That wouldn't be fair because there's no information for you there. So when asking a question about the phases of healing, you would be aware of the signs and or symptoms. And if I did ask you to identify the time frame, there would be only one logical answer. A very quick summary of these phases is inflammation is that heat phase, followed by proliferation, where there's this formation of granular tissue. We'll talk more about that later. And then that will be followed by the maturation phase, or the remodeling phase, where that tissue is reorganized into healthy tissue or scar tissue. But before we can go down that rabbit hole, you need to learn some definitions as well as various mechanisms of cell injury. From there, we will have a launching point to talk about tissue healing. Ischemia is probably the only word on this slide that you won't recognize. Ischemia means lack of blood supply or an insufficient blood flow. This will result in a critical reduction of oxygen to the tissue, which can cause necrosis or tissue death. Ischemia is usually caused by an arterial lumen obstruction, such as a thrombus, an embolus, or atherosclerosis. This can result in many conditions, but the main ones are stroke or a myocardial infarction. Ischemia leads to tissue death. Infectious agents. Those are things like bacteria and viruses we are all too aware of. Viruses are responsible for most infections, but we can be infected by many things like fungus and even protozoa. Sepsis can occur when microorganisms or their toxins are present in our blood. Septic shock occurs with cardiovascular collapse. Septic shock is a critical condition. Immune reactions. Immune reactions are typically defensive agents, but sometimes the immune system gets overzealous and it results in things like our allergies. They can be mild or they can be life-threatening and cause anaphylactic reactions. And autoimmune disorders are another result of immune reactions that can cause tissue damage, such as rheumatoid arthritis. When this occurs, our immune system sees our healthy cells as foreign. Genetic factors. Alteration of structure or mutations of genes can lead to cellular injury or death. Some can be severe enough to cause death in utero or result in congenital malformations such as Down syndrome, which has the presence of a third chromosome in the 21st pair. Other genetic disorders are things like Huntington's disease, and they don't manifest until midlife. Some gene mutations cause high blood pressure, diabetes mellitus type 2, sickle cell anemia, and other genetic diseases. You will learn about many genetic diseases in this class. Nutritional factors. Deficiencies in essential nutrients can cause cell injury and lead to death. It can interfere with protein synthesis or just the ability for our nerves to fire properly. Knowing what you know now about anatomy, how do you think malnutrition affects healing? And what if someone's low in the mineral iron? What would they have? Anemia. And what are the signs and symptoms of anemia? It's pale skin, weakness, and fatigue. The body needs fuel for there to be fire. Physical factors. I probably don't have to go into a whole lot of detail, as it includes things such as trauma, which could be caused by motor vehicle accidents. It could be a traumatic brain injury, a stabbing, blunt trauma to the head caused by a falling guitar, because we all know we got to look out for falling guitars. Repair of these sorts of injuries often involves the internal organs, soft tissues, muscular and skeletal systems. Mechanical factors. Physical stress theory states that changes in the levels of physical stress on a tissue will cause a predictable adaptive response in that biologic tissue that may result in injury. So what exactly does that mean? It means injury occurs when the applied load exceeds the tissue tolerance. One of the ways a PTA can cause mechanical injury to their patient would be by overstretching them or overzealously putting them in an injured body part into a stretched position. That will cause a very predictable reaction of muscle guarding followed by tissue tearing. There are other more subtle ways that this occurs. For example, an area of the body may have a history of physical stresses, so the accumulation of all those individual little stresses over time can eventually cause an injury. Hence the expression, the straw that broke the camel's back. A repetitive task may initiate an inflammatory response due to frequent cell injury. Visualize a postal worker who lifts heavy boxes all day with poor posture. Repetition can cause slow degradation of the tissue, and over time, degenerative changes will occur. The tissue will slowly lose its tolerance, resulting in injury. These sorts of degenerative injuries do not usually show signs of inflammation. Examples are tendinitis or golfer's elbow. It suggests that the acute phase resolved over time and the fibrotic proliferation phase is active. The takeaway is ligaments in our tissues can rupture from a single force, but also fail from repeated bouts of moderate stresses. The same is true for bone. They can undergo stress fractures from repeated episodes of moderate stresses. Finally, let's take a look at chemical factors. Toxic substances such as mercury, mustard gas, chemotherapy can cause chemical injury. Free radicals are a normal part of metabolism, and they are formed continually in the body. A free radical is an atom that has one or more unpaired electrons. You may recall from chemistry that an unpaired electron is going to seek out balance, and it will take that electron from something within our body that needs it. Cellular enzymes scavenge the body to protect the cells from those unpaired electrons, but a buildup will result in cell injury and cell death. Free radicals are thought to be a cause of degenerative conditions like heart disease, diabetes mellitus, and even Parkinson's. They are often considered lifestyle diseases. Use of antioxidants has been helpful to neutralize these free radicals and stop them from taking electrons from other molecules in our body. The signs of inflammation: redness, heat, swelling, and pain. With those comes the loss of function. I imagine every single one of you has injured some part of your body that resulted in redness, heat, swelling, and pain. I get it almost every night when I get bit by a mosquito. Redness, heat, swelling, and pain, inflammation. On average, it will last 1 to 2 days. It can last up to 10 days. And inflammation must happen for healing to occur. It is the first phase of healing. Let's take a closer look. Inflammation is Latin for to set on fire. Inflammation occurs in the interstitial space. That is the space in between the cells, the space that is not occupied by cells. Edema, inflammation, and swelling are words that tend to be used interchangeably. Edema means fluid accumulation. Swelling is the word our patients generally use to describe their inflammation or edema. Be able to recognize the signs of inflammation in your patient. Close your eyes and say the 4 signs of inflammation to yourself. Redness occurs because of vasodilation. The blood vessels expand and more blood comes into the area, causing redness. This is the exact same reason why there is heat in the area, as the blood carries a lot of heat to that space. It's called hyperemia. Swelling occurs because of that increased permeability. Suddenly the blood and other fluids can come into that interstitial space. This causes the tissue in the area to be very full and to expand. Pain occurs because of the pressure in the area. That increased pressure on the tissue and on the nerves can cause pain. Pain can also occur due to chemical irritation. While we're on the topic of body fluids, let's talk about transudate versus exudate. Transudate is clear, and that's because it's predominantly dissolved electrolytes in water. Exudate, on the other hand, tends to have more of a yellowish orangish color. Exudate is a result of the increased permeability of blood vessels. This allows more cells and plasma proteins to cross those vessel walls, and that's what makes the fluid more viscous and cloudy. So there's a high content of lipids and cellular debris in exudate. Anyone who's seen a blister pop has probably seen exudate. Pus, represented here by a silly cartoon. Pus contains liquefied products that have been digested by white blood cells. So it contains leukocytes, neutrophil, the liquefied digested products of those cells, so dead byproducts, as well as like fluid exudate, and there's often bacteria in pus as well. You are welcome to pull up as many images on pus as you would like, but I'm sure everyone who has popped a pimple knows what pus is. Although I will confidently say that not all pus is created equal. Let's talk about tissue repair. You remember how I mentioned that you could ignore hemostasis for now. Well, now let's define it. Hemostasis is what happens immediately following an injury. It is the first thing that happens. Means stop bleeding. But this is not part of the phases of healing. That which start with inflammation. So hemostasis is its own thing. Think of it as like a pre-inflammation phase. And it occurs when the body tries to stop the bleeding via a blood clot or coagulation, the clumping of platelets. Platelets will release a chemical signal that summons other cells to the area. The chemical signals put out by the platelets have provided vasodilation. They have called in the troops to start the inflammation phase, and that phase begins once the blood clot is formed. Vasodilation opens the doors to allow our body's first responders to get on the scene. These leukocytes and macrophages come to the scene and start slaying bacteria. Vasodilation has another benefit. Oxygen and nutrition is delivered to the wound, and carbon dioxide and other waste products are absorbed and carried away through the capillaries. But this does allow more fluid to leak into that interstitial space, which causes swelling, aka edema. These dilated blood vessels can give the wound or the skin in that area that red appearance and the warmth. Let's talk about the macrophages just a little bit longer. They are eaters. So they go in and they are just going to eat and clean up bacteria and debris. And they are what you will see in pus, and as well as the byproduct of the things that they've eaten and destroyed. While they go about their business, there are other cells that have other jobs. For example, the fibroblasts are going to be laying down some collagen, and epithelial cells are going to be forming granulation tissue. They're basically going to be moving into the wound bed by holding on to that collagen structure that was created by the fibroblasts. And this allows for that accurate regeneration of the pre-existing structures of the tissue. It's all really pretty amazing. This newly forming tissue is delicate and it is easy to reopen the wound at this stage. However, inflammation is not all sunshine and rainbows, as it is possible for it to cause injury to other nearby normal tissues. We will also learn other ways that the healing phases can go wrong, as too much scar tissue may be laid down, causing adhesions to organs and muscles. Before we move on to the next stage of healing, we should distinguish acute inflammation from chronic inflammation. Thus far, we have been discussing acute inflammation. It is normally controlled and self-limiting, and resolution will depend on the extent of the injury. For mild tissue damage, full, complete regeneration is often possible. For moderate to severe tissue damage, there may be healing with some scar tissue, or there could be chronic fibrosis. Providing the injurious agent is removed, then acute inflammation should resolve. But if the presence of this injurious agent remains, for example, think back to our postal worker lifting heavy boxes with poor posture, then that could result in chronic inflammation. This can also result when too much scar tissue or tissue necrosis is present. Autoimmune diseases can also be a cause for chronic inflammation. Take, for example, rheumatoid arthritis, where our healthy cells in the joints are constantly being attacked by the immune system. This will cause chronic inflammation. Common symptoms of edema are pain and muscle guarding, and common signs are redness and swelling. Inflammatory reactions can last for as little as a few minutes. For example, when you scratch your skin, it just may get a little raised and red and resolve almost immediately, versus a chronic condition where the swelling can last for years. When observing edema, it is important to ask questions such as how long, what is the duration, and is it regular, does it happen often? What causes it? Is there a certain activity that is being done that brings it on? Our role as the PTA is to help get the patient from the inflammation phase into the next phase of healing as quickly as possible. Now let's talk about the proliferation phase. The formation of new tissue signals the beginning of the proliferation phase. This is called epithelialization. It establishes a vascular network, which is that granulation tissue, looks like raw beef. This vast vascular bloody network helps to transport nutrients and oxygen to the tissue. These are newly formed temporary capillary channels. As the tissue healing continues, this new vascular blood flow will shut down, and it'll only leave a few or no blood vessels remaining in that mature tissue or scar tissue. In this phase of healing, any gaps in the tissue repair will be filled with collagen. Wound contracture occurs when the edges of the wound are pulled together. This is different than when the surface is covered with epithelialization. With that process, the epidermis begins to creep over the new surface as far as it can, and where it cannot close and meet itself, scar tissue will be left. The maturation phase begins when granulation tissue and epithelial differentiation begins. Epithelialization refers to cells migrating upwards to close the gap. This is where granulation tissue transforms into normal healthy tissue. This is also referred to as remodeling. This phase could last anywhere between 7 days and 2 years. The cells in the capillaries that are no longer needed begin to thin out. The original collagen is now replaced with new collagen that is arranged in a more favorable pattern. These mechanisms of reorganization help to contract and close the wound and shrink it to a small scar. Newly repaired tissues have approximately 15% of their initial tensile integrity. Over time, that tensile integrity may increase up to 80% of their pre-injury strength. And this, my friends, is a magical phase for physical therapy. This is where the fun stuff begins. We can start with stretching. We can really begin to work that range of motion and get them back to their normal, full potential. Some strengthening may begin depending on where they are in the process of remodeling. The orientation of the collagen fibers will determine the level of function. That means that we need to get them moving in functional patterns so that the collagen fibers that are being laid down align with functional mobility. Picture this. There are many lumberjacks chopping tall pine trees and letting them fall into the river below. They are throwing these logs down in a very random order. It's just falling down into big piles. Nothing is lined up, all into the river. They represent the cells laying down the collagen fibers in just random orders. All they know to do is produce collagen. The river water is flowing and it is helping to orient the logs, but some intervention is needed. These disordered logs will start to take on the flow of the river. They will reorientate themselves so that they can move down the river and float along with the water. Think of the lumberjacks who work in the water, helping to align these logs to assist in this process as our therapeutic exercises, our range of motion activities, and our stretching. They are facilitating the process to improve the flow of those logs representing our collagen fibers to get them in the right orientation for maximal river flow, or in our case, for full range of motion. When people continue to guard their injury and they do not move it in this phase of healing, they are at risk for scar tissue forming that does not allow them to return to their full range of motion, as there was no activity in that flow of the river, and that scar tissue was laid down randomly and it stayed laid down randomly. We must purposefully move as big as possible to reorient those collagen fibers to allow for function. That's our segue to talk about scars. To talk about what is abnormal, we must first identify what is normal. An immature scar will be raised, red, and rigid, whereas a mature scar will become pale and flat and palpable. A normal scar is palpable. Abnormal scarring includes keloids and hypertrophic scars. Keloids are a collagenous mass that protrudes from the surface of the skin. They tend to grow larger and appear worse over time. They can also invade surrounding tissue. Keloids can be removed surgically and treated by other means, but no treatment is 100% successful. Hypertrophic scars are a little different. They will also raise above the skin surface, but they generally calm down after 12 to 24 months. Hypertrophic scarring will also occur within the original boundaries of the original injury. It will not invade the surrounding tissues. Collagen is extremely important. It serves to support most of the structures in the body. It provides the glue or the strength that holds those tissue fibers together. There are at least 27 types of collagen in the human body, but I'm only interested in having you know about these 3. Type 1 is the most common and it is very strong. It is in all tissues of the body, including the tendons, the bones, and mature scars. Type 2 is supportive and it's found in cartilaginous tissue. Type 3 is a highly soluble collagen, and it is the one that is first deposited in the wound bed. It is strong, but it is a thin filament, and it's very supple and elastic. Tension theory. Tension occurs when 2 forces are applied in opposite directions. This occurs when somebody stretches. It also occurs during loading to improve strength. You will learn about these techniques in Rehab 1 and 2. The different techniques listed on this slide will directly affect collagen structure, and over time, the tensile strength should improve. You will learn these techniques in other classes, but I will briefly discuss them here. Muscle tension refers to a muscle being semi-contracted for an extended period of time, such as with an isometric exercise. Joint movement involves getting that full range of motion or those big movements in of the joints. Soft tissue loading and unloading refers to strengthening. Fascial gliding is essentially scar massage. I will be teaching you different techniques in Procedures 1 on how to do skin rolling and friction. Joint mobilizations occur in a straight line and they are passive for the patient. They address arthrokinematic joint motion. I do not expect you to fully understand these interventions at this time. I do expect you to understand that these are interventions that we use during the maturation phase to improve the tensile integrity of the newly forming tissue and scar. Once again, length and mobility of an injured area may be modified by the application of stress. But let's talk about when it is appropriate and when it is not. For example, a low load, long duration stretch. Think of this as a stretch that you would hold for 5 minutes or longer. What phase of healing would this sort of activity be appropriate in? Would you stretch a patient with a low load, long duration stretch during the inflammation phase? No, that would not be safe. The tissue is newly damaged and susceptible to further injury. Would you stretch the patient during the proliferation phase? Yes, but it would have to be very controlled. You would need to be in good communication with the patient and advise them that they must be in a pain-free range of motion at this stage to avoid further aggravating the injury. Would you stretch the patient during the maturation phase? Absolutely, and possibly even aggressively. This is our final opportunity to get the tissue to do what we want it to before that scar tissue lays down and remains permanent. Prolonged immobilization will lead to bad outcomes, but immobilization does have its place in healing. Immobilization usually occurs during the maximum protection phase. This is to protect the injury to allow for healing. During immobilization, there is no use of the injured area. But this should progress into actively working with the healing tissue to improve outcomes. Part of our job is to educate a patient on the dangers of immobilization. The tissue needs to be exposed to tension. However, it must be paced appropriately. What happens when tissue healing is delayed? It is believed that the most significant factor that delays wound healing is an abnormal inflammatory response, whether that is a chronic inflammation or whether it has been delayed. Many variables regulate or affect the healing process that will either facilitate or inhibit wound healing. For example, what is the local blood supply? As blood supply is vital to delivering the materials needed to heal the wound. Certain tissues like tendons, ligaments, or cartilage have very little vascular supply. Thus, the healing process may require additional time. Other well-vascularized areas, such as our scalp, will heal relatively quickly. In Procedures 1, you will learn how to use heat to increase the vascular supply to an area to aid in healing. Improved blood flow means improved circulation, so that's more nutrition in and more bad things out. The size of the wound also matters. It is very logical that the smaller wounds will heal much faster than the larger wounds. And also think about the type of the wound. For example, a surgical incision will heal much faster than a traumatic wound because the cut, as they say, is clean. The process of the wound contraction is much easier to help with closing that wound faster. Infections are another major reason why wound healing may be delayed. When infections are present, they often increase protein loss, and healing requires protein synthesis. We also have to consider external forces. Some of them can be good. Like us, we may use physical agents for interventions. We also may be a wound care specialist that debrides the wound and removes the necrotic and infected tissue. The RN can help keep it clean and dressed. These are all positive external forces. Negative external forces could be things like exposure to the elements or other contaminants, or, for example, harsh or inappropriate wound care, or even re-injury due to shearing forces or premature loading and stretching. There are also systemic reasons why wound healing may be delayed. For example, age. That is certainly going to have effect on healing. Young patients generally heal faster than geriatric patients. Their metabolic system is more active and they are less likely to have other diseases. Segues into other diseases can also affect wound healing. This is called comorbidities. An example would be an elderly patient with rheumatoid arthritis that is on a drug that suppresses the immune system. They may also have diabetes mellitus, which can result in vascular compromise. They have poor nutrition, they step on a nail, and now they will have a difficult time healing. Versus a 15-year-old boy who stepped on a nail who is healthy, active, and disease-free. The boy has plenty of nutrition and a normal metabolic system versus the senior who has diabetes, poor nutritional uptake, poor circulation, and they're more likely to get an infection because they're on immunosuppressants. Skeletal muscle. Adult skeletal muscle tissue can regenerate in response to direct injury, neurological dysfunction, or genetic defects. This healing process begins with an activation of muscle stem cells. These are called satellite cells. Once activated, the satellite cell multiplies and can differentiate into specific types of muscle fibers that will eventually fuse and reconstitute the muscle tissue. We have the power to regenerate, but it's likely that this only occurs for a finite number of times. After that, the muscle seems to no longer be able to repair itself that way, and instead it will become invaded by scar tissue. Cut and crushed injuries occur when the fibers are damaged by either being cut or crushed. These types of injuries can be repaired by those satellite cells. The damage initiates the reaction, which activates them to multiply and fuse with the existing fibers to repair the damaged sarcolemma. A strain occurs when there's a tearing of the fibers at the musculotendinous junction. The tear often occurs at this site because the muscle fibers are more compliant versus the non-compliant tendon structure. The strain occurs when the force of the stretch is too great to be resisted by the contractile unit of the muscle. This will result in disruption of the tissue fibers. A contusion occurs with a sudden, heavy compressive force to the muscle. These are capable of regenerating themselves, but there will be prolonged loss of strength, and after healing, there is a high rate of re-injury. Every year, someone asks me the difference between a contusion and ecchymosis, so I'll go ahead and tell you now. Ecchymosis is bruising or bleeding under the skin, and it is spontaneous. A contusion describes the injury as a compressive injury. Stiffness. By age 40, elasticity of the muscles goes down and our tendons and ligaments will have less water. We get more stiff. Connective tissues change as we age. I know you want me to tell you it's not true, but it is true. But don't worry, there's lots of good news coming up. As we age, small amounts of microfibrinous adhesions start to collect among our muscle cells within the fascia, and that's part of what makes us feel stiff. I know we all want to believe we're impervious to such things, but it's true. We age. But there's hope. Movement will break up these adhesions. Movement will prevent them from building up within your body. Immobility, sedentary lifestyles, scar tissue, and aging are all contributing factors to stiffness. I know we can feel stiff after prolonged exercise, but this is not the same. That is fatigue or soreness due to the release of muscle enzymes, otherwise referred as DOMS, delayed onset muscle soreness. Let's talk about them bones, fine bones. So there's a variety of conditions that can affect bone and infect. There can be fractures, infections, metabolic disorders, tumors, and implanted prostheses. But for now, let's start with fractures. I mean, why jump ahead of ourselves? We are talking about the phases of healing after all. And bone follows a very similar pattern, except there are a few different players on the scene. Bone also has blood vessels that run through it. So when the bone is broken, there is bleeding. And the first thing that happens is hemostasis. The clot will form. The vascular response follows next, which brings on inflammation and cellular proliferation to the area. And a fibrin meshwork is formed. The second phase of healing for bone is referred to as the reparative phase. This is when osteoclasts clear away the necrotic bone while the endosteum and the periosteum regenerate. This process forms a soft callus at the fracture site. The callus becomes hard during a process referred to as endochondral ossification. The reparative phase will generally last 6 to 12 weeks. Then begins the remodeling phase. This is possible when there is no more movement at the fracture site, and it will persist until the bone has returned to normal with no scarring. This includes the full restoration of the medullary canal. The remodeling phase in bone can take months to years to complete. There are a few things that are required in order for bones to heal properly. They need to be held in the correct position and protected. This could mean a cast or using an assistive device like crutches. Full remodeling means there is no scar. The fracture is clinically and radiologically healed. There is very good potential for a return to optimal tissue function with bone healing. Osteoblasts are the bone-forming cells, and they help to form that callus, while osteoclasts will break down the previous damaged bone matrix. In a normal, healthy person, the bone will completely regenerate over time because of this partnership. The bone-forming cells on either side of the fracture will begin to work their way towards the center, and they will grow together. When the fracture closes, the callus can be reabsorbed. I think bones are an osteoblast. Tendon healing. Tendons will go through the same phases of healing as other tissues. But with tendons, it tends to be a slower process. Yes, I have hit you with 2 puns in a relatively short time. No apologies. So far, we have talked about muscle tissue and bone tissue, which have a great blood supply. Now we're going to talk about tendons and then into ligaments, where we are losing blood supply and the healing process is more difficult. Tendons connect muscle to bone. They are dense bands of connective tissue that have elastic properties as well. They allow them to sustain high unidirectional tensile loads. They are strong and flexible. Because tendons have poor vascularization, they get a little help from their neighbors. Surrounding tissues will contribute to the healing process, but unfortunately, that also makes adhesions a lot more common because surrounding tissues are throwing down collagen and they can get stuck to each other. But movement at the right time will help to break those adhesions up so that the tendon won't get stuck to the nearby tissues. Tendons will have their inflammation phase, and it's standard to last 3 to 5 days. It is common for this to overlap with the proliferation phase, which will tend to last 2 to 3 weeks. During this phase, the area undergoes angiogenesis, which is the formation of new blood vessels, and the tendon needs to remain immobile to relieve the stress and prevent re-injury. However, tissue modeling continues to deposit large amounts of disorganized type 3 collagen. This is immature, it's randomly oriented, and it has limited strength. Tendons are very easy to damage again during the proliferation phase. Usually around 3 weeks, the remodeling or the maturation phase will begin. This is the process where it's going to replace that type 3 collagen with the type 1 stronger collagen. But this is also the time where we need to align that collagen along with the tensile forces. Based on animal studies, we know that healing tendon takes at least 12 to 16 weeks to reach a level where the tendon can be stressed. Studies show that maximal muscle contractile forces need to be avoided for at least 8 weeks. Maximal muscle contractile forces should be avoided for at least 8 weeks. As PTAs, we should expect to see significant tendon weakness for a considerable period of time. We have to teach our patient how to progress without re-injuring the tendon. As stated previously, mechanical stress is required to promote appropriate orientation of those collagen fibers. This is so important during the remodeling of the collagen into its mature form. It is very important that we follow the doctor's protocol for tendon repair. It is also worth mentioning that poor results are common with active contraction at less than 3 weeks from the repair. During this phase, patients are often immobilized to allow for the tissue healing to occur. As you have 2 eyes and you're capable of reading your own slide, you will see a few additional notes that the repair is weak in that very first week or 2 of healing. And it can take up to 6 months to regain maximum strength, and that still may only be about 60% of what it originally was, or around 2/3. Ligaments. What do you think? Do you think ligaments go through the same phases of healing as other tissues? I think by now you should expect that they do. But of course, you have to keep in mind that this type of tissue has its own dedicated timeline and its own effectiveness as to what it is able to regenerate. Ligament injuries occur with excessive movement at the joint because ligaments attach bone to bone. Sprains and tears can be classified as first, second, and third degree. A sprain involves a ligament. A strain involves a tendon. And the way I like to remember that is a strain has a T in it, just like tendon. But there is no T in sprain, and so by default that makes it a ligament. Let me define these 3 grades for you relatively quickly, and it involves whether it's a sprain or a strain, the grades are the same. So that rhymed. With a grade 1, there will be a minor injury to the damage to the tendon or the ligament. A grade 2 is a moderate to severe tear, but that is incomplete because a grade 3 is a complete tear of the tendon or the ligament. Because ligaments attach bone to bone, after an injury, there will be joint effusion, which is swelling in the joint. This may also be referred to as intra-articular swelling, or the fluid is in the joint capsule itself. When the ligament gets damaged, the thin synovial sheath is disrupted, and the blood is going to dissipate through all that fluid, which will prevent clot formation. Clot formation is the foundation of healing. Without it, the ligament will not heal. Additionally, some ligaments release an enzyme called MMP that has a devastating effect on healing. Ligaments have poor vascularization, but it does vary from ligament to ligament. For example, the MCL, your medial collateral ligament, can heal fairly well, but the ACL, the anterior collateral ligament, does not, and it will often require surgery for repair. Additionally, the ACL is inside that joint capsule, so as the bleeding occurs, it just dissipates into that joint fluid and it's not able to clot, where the MCL is external to the joint capsule and it will have a better success rate at clotting. Later on, I will go into the details on how there are surgical repairs for ligaments and tendons. For right now, we'll just stick with the basics, and we'll say that with some ligaments, they're just going to work with stabilizing the joint, especially if the tear is incomplete, and then they're going to work with apposition of the torn ligaments. Apposition is just a fancy way of saying putting side by side, because the ligament ends won't find each other. We have to help it. Ligaments heal very poorly, and they will usually be 30 to 50% weaker after recovery. Cartilage. Chart 3.6 will indicate the types of cartilage. It will be found on page 77. Take a moment and read this over. Cartilage is aneural, avascular, alymphatic, and does not appear to regenerate well after our adolescent phase has ended. The damage will either not heal at all, or it will be replaced with fibrous tissue. Fibrous tissue will not function as well as the original articular cartilage. What effect does the scar tissue have on that adjacent joint surface. It can cause additional damage and lead to more local degenerative arthritis. Let's talk about common cartilaginous injuries, such as a meniscal tear. A meniscus is primarily made up of water and cartilage, and they're in your knee. See figure 3.25 on page 79 for common types of meniscal tears. You are responsible to be able to identify these, because it does matter that we understand our patient's injury. In adults, only 10 to 30% of the outer edge of the meniscus is vascularized. Healing outcomes are based on the location of the tear on the disc, so the less vascular areas will have a decreased healing capacity. A partial meniscectomy is when the surgeon will go in and just take out the damaged area. This has poorer outcomes than a meniscal repair. In a meniscal repair, the surgeon will instead go in and remove the necrotic debris and try to reattach the meniscus where possible and save as much tissue as they can. Articular cartilage is a little bit different because there is some vascularization of the bone, which will allow for some healing to occur and repair some cartilage, but it is not as strong and the joint is still predisposed for degeneration. I know the chapter wraps up by talking about degenerative disc disease in regards to the disc in the spinal cord. We're going to talk about that quite a bit in our musculoskeletal PowerPoint lectures, so I'm just going to skip over that part for now, as you will hear all about it in our upcoming lecture. Instead, I want to take some time to go over all of this stuff in a more meaningful way. So we're going to start by going back to the acute stage, that inflammation period, and think about our patient. The patient's response. They're going to have pain and muscle guarding. We've all experienced muscle guarding. None of us want anybody to quickly move a part of our body that we have injured, and so we'll freeze up, and that's how the body protects us. It's like our own muscular cast, and so muscle guarding is a way that the body will try to hold rigid and avoid additional injury. They're going to have impaired movement and they're going to have edema. Our role will involve educating our patient on how long they can expect these symptoms to occur, as well as giving them any precautions or contraindications to movement that has been ordered in their plan of recovery. In this phase, we are also going to be very concerned about protection of the injured tissue. We must minimize their pain and minimize the mobility to promote healing. This time period is usually between 24 and 48 hours, and we'll often use RICE: rest, ice, compression, elevation. You'll learn more about that in Procedures 1. Our patient presentation for the proliferation phase or the subacute phase will be a little bit different. Instead, they will experience pain when the tissue is stressed beyond their current tolerance. We should also see the swelling decrease. In this phase, the patient may continue to benefit from immobilization. Why is that? Because excessive early motion can cause microhemorrhaging, and it can increase the chance for infection or re-injury. The subacute phase continues on into the maturation stage. At this stage, the patient should have no swelling. It should be completely resolved, and pain will only be felt in the tight structures. Assigned reading is required. At this point, if you have not read the special implications for the PT at the end of the chapter, box 3.6, you should read that entire section, as well as referencing table 3.7 to learn more about prolonged effects of immobilization. Finally, what did the grape say when it got crushed? Nothing, just let out a little whine. Take care. As always, let me know what your questions are and please use the discussion board. Thank you.